Let me ask you one critical question. Even if you prescribe the right drug, what if it is stored incorrectly? It can lose potency, it can become unsafe, it can even harm the patient. That's why NABH focuses strongly on MOM.3, medication storage or availability, because right storage, safe medication. Hello everyone, I am your NABH guide. In today's session, we will deeply understand how medications should be stored, what assessors actually check, high-risk medication handling, emergency drug management, common mistakes and compliance strategies. This is one of the most audit-sensitive standards. Safe, clean or secure storage. Storage is not just about keeping medicines on shelves. It is about maintaining safety, effectiveness, security, key requirements, clean storage area, safe environment, secure, restricted access, follow manufacturer instructions, temperature, light, humidity, temperature monitoring, room temperature monitoring, refrigerator monitoring, at least once daily, special focus, vaccines, strict temperature control, cold chain maintenance, security measures, restricted access, lockable cabinets, medication carts not left unattended. Critical requirement, expired drugs stored separately, clearly labeled, not for use. Assessors will physically check cleanliness, arrangement, temperature logs, expired drug segregation. Inventory control system, storage without control, chaos. Inventory management is the backbone of safe storage. Required practices, ABC analysis, cost-based, VED analysis, criticality-based, FSN, usage-based, FEFO, first expiry first out, storage organization. Alphabetical arrangement, generic name-based storage, stock verification. Regular audits, detect loss or theft. Special category, not for sale drugs, physician samples. Must have defined handling system. High-risk medication list. Some drugs are more dangerous than others. These are called high-risk medications. Examples: low therapeutic index drugs, narcotics, psychotropic drugs, concentrated electrolytes, LASA drugs, look-alike sound-alike. Requirement: define list, update periodically, display in all areas. List should be available in pharmacy, ICU, wards, OT, storage of high-risk drugs. High-risk drugs should not be everywhere. Requirement: store only where clinically required. Example: ICU, OT, emergency. Additional safeguards. Labeling, restricted access, double-check systems. Special case, narcotics, follow legal regulations. LASA or separation. This is one of the biggest causes of medication errors. Look-alike sound-alike drugs. Risk example: dopamine vs dobutamine, INJ. KCl vs normal saline. Requirement: identify LASA drugs, maintain updated list, store separately, different strengths stored apart. Best practice: use color coding, tall man lettering. Assessors love checking this area. Emergency medications list. In emergencies, seconds matter. Drugs must be ready, not searched. Requirement: defined emergency drug list. Customization: ICU, emergency, OT, cath lab. Storage method: crash cart, defined drawers, standard arrangement. Important rule: no extra drugs in crash cart. Availability or replenishment: emergency drugs must be available all the time. Requirement: adequate stock maintained, daily checking. If crash cart sealed, check after each use, or at least monthly. Many hospitals fail here. Drugs used but not replenished. Common non-CONFORMITIES. Now let's see what assessors commonly identify. Improper storage, dirty, unorganized, no temperature logs, expired drugs mixed with usable drugs, no inventory system, FEFO not followed, no high-risk medication list. LASA drugs stored together, emergency drugs not standardized, crash cart not checked daily, stockouts of emergency drugs, no documentation. How to comply? Step 1. Standardized storage. Clean, labeled, organized storage, temperature monitoring. Step 2. Implement inventory system. FEFO, ABC, VED, regular audits. Step 3. High-risk medication safety. Define list, proper labeling, restricted access. Step 4. LASA management. Separate storage, color coding, staff training. Step 5. Emergency preparedness. Crash cart checklist, daily verification, immediate replenishment. Step 6. Documentation. Temperature logs, stock audit reports, crash cart checklist. Step 7. Staff training. nurses, pharmacists, doctors. Final summary. If MOM1 is about system, MOM2 is about control, MOM3 is about safety at ground level. Right storage, right availability, right control is equal to safe patient care. If you are preparing for NABH, don't just arrange medicines, ungli se dahini or ishara build a safe medication storage system. Remember, a drug can save life, but if stored incorrectly, it can take life. In the next video of this NABH training series, we will discuss safe or rational prescription of medications. If you want to learn NABH standards step by step, then video को like करें, channel को subscribe करें, notification bell on करें, so you never miss upcoming NABH training videos. Medi Quality Partners, your trusted NABH guide. Thank you for watching.